Hello, my name is Rachel Shumick, and this is a case study for VTT 244 diagnostic imaging. Today we have Sugar Miller. Sugar is a 10-year spayed English bulldog, and she weighed 65.8 pounds. That's a big bulldog. Presenting complaint. Patient presents with polyuria, polydipsia, and incontinence for the past week. Owner says she doesn't normally urinate in the house. She has done it once before, but that was due to an ETI a couple years back. However, she started to urinate inside the house yesterday and made an appointment when she saw that there was blood in her urine. Sugar is eating a Blue Buffalo diet. She has backyard access and goes for walks in the neighborhood. The last time we saw Sugar in the clinic was in May of 2017. Physical exam findings, nothing too concerning or abnormal. She doesn't have the best skin. It's dry, it's dirty, it's got dandruff, but there's no fleas, no ectoparasites other than fleas and no lesions seen. Really what we're looking at is her eyes, ears, nose, throat, and you can see that there's discharge coming out of her eye, mild conjunctival hyperemia edema. So it's very watery, very moist in her eyes, and she's also present with ectropion, but that's very common in bulldogs. And when we're looking at urogenital upon palpation, doctor didn't feel anything abnormal, and her bladder did feel empty. So for diagnostics, he ordered a UA Chem CBC, and he also ordered one lateral view. In UA, all values have returned normal except for the cocci present, and erythrocytes were too numerous to count in the urine. And that does correlate with the owner seeing red urine. In her chem, we saw that there was high alkaline phosphate and cholesterol. And so when we're looking at this, we're also possibly thinking when we see these two factors, this is correlated with liver failure. In a CBC, we saw leukocytopenia, and of course, we suspect that she may have a UTI, so this would be something that we would see as well. And although it wasn't ordered, a diagnostic to consider for this is a blood chemistry profile, since she is older and she would possibly, depending on the results, would have to end up going under surgery. And one other thing I noted was possibly doing an ultrasound versus a radiograph, but the owner did go with a radiograph. Our differentials are mass versus urolithiasis versus cystitis versus renal pathology versus UTI versus liver failure, or maybe something else that we don't see yet. Okay, so upon imaging, we can see here at the bladder, we can see two large stones. And so the doctor believes that these are going to be struvite stones, and these are the most common stones seen in dogs. RBT who took this image is named Katie Holdorf, and present DVM was Jake Hare. So before surgery, a week before, she got prescribed amoxicillin to help fight that possible UTI infection going on, and she'll be getting a urinary cystotomy. So here I have an excerpt written from the medical record of Dr. Hare, him explaining how he did that surgery, and he was able to cut into the linea alba with a 15 blade and extended with mezzobombs to expose the bladder. He then took the bladder and soaked it with laparotomy sponge and used 3/0 sutures. So he was able to cut along the cranial aspect of the bladder and express those two stones out. And they came out really easily. For recovery, she has discharge paperwork that will go home with the owners because it's a lot of information. She does have restricted access to food when she first gets home and is only recommended to eat a quarter serving of what she usually eats to prevent, nausea and emesis. She's got limited exercise for the next 14 days, and she's got to avoid going up and down stairs as well. We recommend wearing an e-collar so she doesn't lick or chew at her sutures and cause irritation or infection or dehiscence. And her diet change is Hill Science urinary care. Medication she's getting is carprofen, which is an NSAID for inflammation, tramadol, which is a synthetic opioid, which is used, for pain management. It's an analgesic. And then she's got amoxicillin to also help prevent and continue to fight any infection going on, since we did see that there was cocci present. DVM called the following day to check on patient, and she was doing fine. She's stable and recovering smoothly at home. And she will be getting a recheck exam in the next 3 weeks with the Coulter sensitivity sent to the lab, and probably repeat some of those diagnostics just to make sure that everything is going back to normal limits. These are my sources.